you guys have mentioned that there has been a level of communication with Damar writing. I'm curious, what are you all able to see that he's understanding or processing what all has happened to him these last couple of days?
We've discussed, with him what happened. He's not quite at the point where we can have a conversation because, again, still has a breathing tube in and is able to communicate with yeses and nos by shaking his head, nodding his head, or with brief notes. He was expressed surprise that he had been, not with the world for 2 days. We've talked to him about all the support that's been given from Cincinnati, Buffalo, and really across the country for him and his family during this time. His mom and dad have talked to him about what has happened, and we expect that we'll continue to have ongoing conversations with him. And again, his first question that he wrote when he started to awaken was did we win? So we know that that it's not only that the lights are on, we know that he's home, and that it appears that all the cylinders are firing within his brain, which is greatly gratifying for all of us, for the nurses and the respiratory therapists and the care team that's been at his side.
I was wondering if you could just add a bit more context on kind of what next steps will look like for recovery from Damar. You mentioned how his health puts him in a good position, but just from a human standpoint, just kind of what is the process like from here for him?
Yeah, from ours, that's a great question. And there are many, many steps still ahead of him. From our standpoint, we would like to see him continue to improve, to be completely breathing on his own, and then to be, ready to be discharged from the hospital. So those are the immediate next steps as we go for his care. His family has been with him at his bedside, as have members of Buffalo Bill organization, really since this all began. And we really want to get him home to them. And so those will be the immediate next steps. And then we'll talk about, potential plans for the future.
Our team involved, a significant number of the care team involved in helping with Mr. Hamlin on the field on Monday night. He was attended to by 4 of our emergency physicians serving in the various roles as the airway physician, the visiting team medical liaison, a neurotrauma consultant, as well as one of the team physicians for the Cincinnati Bengals. As everybody knows, Mr. Hamlin suffered a cardiac arrest on the field, and it was promptly recognized by the Buffalo Bills medical staff, and that allowed for a very immediate resuscitation on the field. He was promptly resuscitated. It did require CPR and defibrillation, and at which point he was transported to the University of Cincinnati Medical Center, where he was met by Dr. Pritts and the trauma team, as well as our emergency medicine colleagues. He was managed and resuscitated and worked up in the emergency department, had some additional tests in the ED and in the hospital, and then has been managed in the surgical ICU, as Dr. Pritts said. It's been a long and difficult road for the last 3 days. He has been very sick and has made a fairly remarkable recovery and improvement to the point, as Tim noted, he is now demonstrating that sign of good neurologic recovery, as well as overall clinical improvement, as has been previously reported, related to not just his vital signs, but a lot of his other individual organ recovery. He was intubated on the field, had what I would deem a textbook resuscitation on the field from, again, immediate bystander CPR, defibrillation, airway management, and then transport to the hospital. It's critical that we do that resuscitation at the scene of where a cardiac arrest is. That portends the best recovery. There was no trach or airway other than the endotracheal tube that he has. As for the long-term recovery, again, we're focused on the right now, and he still has a little ways to go in terms of liberation from the ventilator, and I think that's going to be our focus right now in terms of helping him to recover, liberate, continue to get stronger, and rehabilitate. But it is entirely too early to project into the future.